So I'm David Pearson, I'm the Chair of Tech Quality, and it's my great pleasure to introduce this session, Unlocking the Power of Proactive and Preventative Service. And we've got a stellar lineup of speakers, so much so that we haven't really got much time for questions probably, but if you have a question and you want to put it into the app for this session, we'll see how we get on at the end, and if you don't get the answer to the question, you can always nobble the people as they come off the stage to ask your question. So we have these great contributors, and I'll introduce them separately when we speak. And then if I just move the slides on. So we've got the colleagues there, and you can see who they are. We've got Paul, Neris, Bradley, Rupert, and Sharm, and Sam. So that's great. We've got people on this. And then what I want to do is then, without further ado, hand over to Paul Burney, who is the former Chief Commercial Officer at Anthropos Digital Care, and in that role was a key contributor to TSA efforts to build the sector. He's therefore ideally placed to write a blueprint on behalf of TSA and ADAS, which I have the privilege of co-chairing with Melanie Williams, who some of you will have heard on the stage this morning. So, over to you, Paul.
Thank you, David. Good afternoon, everyone. So, this is my, I think, 6th year in a row of coming to iTech. And to a certain extent, it feels like nothing has changed. It feels like everything's still the same. We're still trying to find ways of unlocking proactive and preventative care. But actually, walking around this morning, talking to lots of colleagues and former competitors of mine on their stands, what most people were saying to me was, actually, the conversations that we have are no longer about the why, they're much more about the what and the how. We get it, we should be doing something in proactive care. In fact, it's one of the government's 3 big shifts, but the questions that people are asking are not about the why. So this is what TSA and ADAS have been working on. We want to find a way to unlock this by building upon the best practice of what's already being done by those who are doing something in the proactive and the preventative space. Because we all know what the promise of proactive and preventative care is. You know, on behalf of the people in receipt of care and support, it's about helping them to get better care outcomes and better care experiences. It's about helping people to stay safe, well, and independent in a place of their choosing for as long as possible. Simultaneously, for local authorities, it's about demand management. In some cases, it is about cashable savings, but it's much more about the demand management part of it, and that's achieved through stopping and reducing and delaying costs. It's not bad to talk about both things being done simultaneously, because both are possible simultaneously. They're possible simultaneously because what proactive and preventative care can do better than anything else is provide data and insight that makes it possible to make a better informed care decision. If it's so simple and so obvious though, and most people agree it is, so 2/3 of all of the local authorities in the UK who answered the recent TSA PA consulting survey said proactive preventative care is the future. It will replace everything else. So if it's so obvious, then why hasn't it been adopted by every local authority? Why isn't it business as usual for everyone? Well, that's actually because there are still so many easy questions for people to ask that don't appear to be answered. Not least of which is, where is the evidence that it works? So what we did was set out to talk to all the local authorities and the care providers and the technology companies that we could, who are already doing something beyond pilot. And that's the really critical bit, is people who have managed to make this business as usual. And we've talked to over 100 people over the last 5 months, and we've used their insight to build a peer-reviewed and peer-put-together blueprint. And the blueprint's in 3 parts. The first part is a step-by-step guide that takes you everything from creating a vision for what the purpose of the proactive preventative care service is, through to planning it, service design, through to involving the people with lived experience in co-production, all the way through to running a pilot, how do you get out of pilot into scale-up, and beyond. Secondly, is we've got a solutions overview. And the solutions overview is exactly that. And the important word there is the services part of it. We're not reviewing the tech, we're reviewing how the service works and what's the point of the service, what questions does it answer on behalf of the local authority and the people in receipt of care. And thirdly, we've got a financial model. And the financial model is built upon one that has been written by the Treasury, from the Treasury Green Book, and approved by the Department of Health and Social Care. So at the end of all of this blueprint, which we'll publish at the end of next month, should allow a local authority, if they want to start from scratch, to say, what are we trying to do with proactive preventative services? How do we do it? How do we build upon the best practice from our colleagues who've already done something? Who are the exemplars who've done it? And how have they built the benefits case and the ROI so that I can present something similar to others? Now, although we don't publish until the end of next month, I'm going to give you a sneak preview of two parts of it. The first is that the step-by-step guide sets out how to launch these services in 4 phases. And each of the 4 phases has 4 or 5 sub-steps within it. For every one of those, we will outline, or we do outline, why is that stage important? Why does it occur now? What is the goal of that stage? What are the key considerations that you should be thinking about if you are a commissioner or a technology lead, or indeed a tech supplier? What are the key questions the local authority should be asking themselves at this stage? Where else could they learn more about what's been done? Because we don't want to repeat fantastic work that's already been done by others, so we'll reference everything that we know is already there. We've got examples of lived experience and considerations from people with lived experience throughout the entire process. So we've interviewed a whole load of people with lived experience, and they also serve on the commission, helping us shape what this document is and how it works from their perspective. We'll name exemplar local authorities who are running these kinds of services, share some of the details of how they've done things, and then introduce a kind of checkpoint. Do not pass go, do not collect your £200 if you haven't done the things in this stage correctly. In that way, we're hoping to help them avoid making the mistakes that often get people stuck in pilot world only. The second thing I'm going to share with you is what we've discovered is that there's probably 4 common approaches that local authorities have applied to running these kinds of services. They either do it all themselves in-house, they do it mostly in-house with some support for selected tasks and selected parts of the session, or they outsource a managed service to a specialist partner or set of partners, or indeed they generate or create a trading company of their own and treat that as the outsourced partner. What we're going to focus on in the rest of this session is that 3rd and 4th model, where we'll have people from London Borough of Sutton and from Access and from Mediquip talk about that experience of working together in a service partner. And then Sam will talk about the experience that Delta Wellbeing has in helping manage the services for Carmarthenshire and beyond. So, when this document gets published at the end of next month at the ADAS Spring Seminar, I think it does a couple of things. First of all, it answers those questions that I posed and more at the start. It offers an opportunity for local authority commissioners and tech leads to learn from their peers and not be driven by tech, but actually just by the experience of their peers. And I only heartily encourage my colleagues who are in tech supplier companies that when this is published, take it, review it, understand where you fit in all of this, and understand how you can help and support local authorities to introduce these services. Because I want you to be optimistic about it. There is more than enough evidence of how these services work and how they deliver for people who draw and care and support, for us to build out proactive and preventative services to become mainstream and become business as usual. And this is a really key step by TSA and ADAS in trying to help that make happen. The rest of this session is to hear from people who are actually doing it now. Thank you.
Thank you very much, Paul. So a whistle-stop tour through the piece of work that's taking place at the moment. I'd now like to introduce Nerys Hebden, Head of Tech Customer Enablement Access Group. Nerys supports the customers to expand beyond pilots and reap the benefits of proactive and preventative care at scale. From investor-saved business cases to how to unlock the benefits with data insights and sharing best practice stories to inspire others to adopt better tech. So Nerys.
Thank you.
Yes, it's very good.
Thank you. It was a real privilege to be part of the TSA ADAS Commission. We had suppliers sitting alongside social care practitioners, directors of adult social care, and people with lived experiences. So thank you to Rich and Deborah and Clinton for reminding us what good looks like and why it matters. It's 2025. There is some amazing technology out there. We've all got used to having AI in our lives. We've got apps in our pockets with personalized insights. And it's time for us to embrace those technologies into social care where it can really make an impact. And there was a real collective desire in the Roundtable Commission to achieve better outcomes for people. People want to deliver the prevent, reduce, delay statutory obligations of the CARE Act. But we also heard that real struggle from local authorities to balance their books and to move to these preventative technologies. As a director of adult social care said to me recently, Nerys, I care really deeply about people, but I also increasingly now need to care about money. So I'm really proud to share with you today how in Sutton they've achieved both. So in order to meet that scale challenge that's facing adult social care, Sutton have commissioned an at-scale solution. And what that means is every single person referred into the tech service in Sutton is offered activities of daily living sensors as part of their alarm service. So whether that's a GPS wearable to help them go out in the community, or smart plugs or motion sensors, everybody is given that service as standard, which is fantastic. And there's two benefits to this. So on the health side, the AI in the technology is alerting family alarm receiving centres to any changes in those daily routines. So any early signs they're able to react to. So the ARC can dispatch a responder or a next of kin, and we're preventing that real distress for people in crisis. It's also preventing ambulances and admissions and delivering savings for health. But it's on the flip side that we've seen the real benefits. And that's in just evidencing that people are well, people are managing well at home with the sensors sort of speaking for them that they're up and about and making their cup of tea and well, and giving that reassurance to family and social care practitioners. We've been able to really see a reduction and a delay in that need for residential and domiciliary care, and that's delivered significant savings to councils. So what does the resident journey look like in Sutton? Well, they've reduced front door waiting lists, they're right-sizing care and reablement packages, and they've delivered fantastic support for unpaid carers with our family app. So I'm going to hear from Marianne in a second. So she cares for her mother-in-law who lives at home alone with dementia. She's been caring for her for 11 years. And this app in the last year has really made a difference to her as an unpaid carer.
It's just a lifesaver. And I have the app. I can check in the morning her activity throughout the night. And it's just so reassuring to have this in place. It's amazing.
So the sensors have also made the service much more inclusive for people that weren't reached by a traditional sort of button and box service. So they've been able to expand to people with learning disabilities, mental health, using the sensors and the AI. And social workers have started to use that well-being evidence and those insights in the care reviews and the panels to help inform that decision-making. But with the 24/7 kind of reassurance that the technology is in place to keep people well. And fortune favours the brave. So Sutton have commissioned an at-scale service and their adult social care budget overspend has been significantly reduced, such to the point that next year they're on track to balance their books, which is fantastic. And it's a really important evidence base for other local authorities that proactive and preventative tech at scale is affordable and it has much greater return on investment. So just finally, these are some of the local authorities and customers that we're working with, increasingly with care providers. They're looking to innovate services and make care more affordable by blending tech into that hybrid care model. So at Access Group, we're agnostic. We partner with different service delivery partners and ARC partners. We're a software company, so we do have our own hub, you can see on the stand, but we also integrate with third-party hardware and systems. We're all about putting the data insights into the hands of family and practitioners so that they can make the right decisions about people. Thank you.
Thank you very much, Neris. So I'd now like to introduce Bradley Cowper, who is the Tech-Enabled Care Manager from the London Borough of Sutton, to give us some further insights into the service being offered.
Thank you. So hi everybody, as I've been introduced, I'm Bradley Cooper. Apologies, I'm not the actor. If anyone's disappointed by that, I am sorry, but I'll do my best. So what am I here to talk to you today about? I'm here to talk to you about how Sutton has rolled out their tech-enabled care service. You can have the next slide, is it here? Okay. Now this hasn't been a quick fix. We have been on this journey for over 7 years, moving from a reactive service to a truly proactive service. We have been very lucky in Sutton that we have been able to deliver a number of trials and learn from those trials so others hopefully don't have to do the same things that we've done and can learn from them. Now, we would all probably recognise that in this space it has been an ongoing sea of trials and testing to determine what works. Well, we've been through that pain. We've seen the opportunities. We were awarded £4.5 million to deliver an IoT programme across South London Partnership, which incorporated all 6 local authorities in that space. We trialled everything. We tested everything, and we learnt a lot. What did we learn? We learnt that data can and will save lives. We learnt about actionable insight and how we can reshape services and operations for residents by having that information at the right time and being provided to the right people to make the best decisions for residents. We decided to take the learning from that IoT programme and rewrite our tech strategy for the borough. We had a really clear vision to ensure that we supported residents to live well and independently, safely at home, taking advantage of the opportunities that digital care technology can offer to support self-care and to anticipate or prevent crisis from ever happening. Now, that sounds very ambitious, but we know this is possible and it isn't new to the sector. What was the challenge previously was the cost. So many of us remember other solutions that were rolled out possibly over the last 30 years or so now. And the prohibiting factor was scale. It was very difficult to do this at scale. Now, we saw at the beginning of my roadmap that there was the announcements from BT around the analog to digital switch, and there was a need to revisit what we already had. Now, many of you have been looking at this challenge and trying to come up with solutions to address the challenge for our local residents that have technology in their homes through telecare. Some of you may have gone out and procured products that were exactly the same with a SIM in them. Others may have thought about what more can we get, what more of an opportunity can we achieve from the analog to digital switch, and that's what Sutton focused on. We wanted a digital partner that could help us deliver and scale the analog to digital switch, but also providing proactive and preventative tech to all of our residents across the community, whether you're open to adult social care or whether or not you're a member of the public that just wants to support a family member. Now, I want to be really clear, this is not about taking people away from people. This is about enhancing the offer, to our community, enhancing the offer to our residents. We want to put a wrapper of support around residents. We want to make sure that they are safe at home, but we want to be able to intervene early, hopefully preventing that hospital admission from ever happening, hopefully putting the right services in at the right time, hopefully not providing care when it's not needed. We heard earlier in the forum where we were hearing about a resident that was having a breakfast call given when they'd already had breakfast. Now, we can be far more proactive with our care and support when we truly understand need and we can be truly person-centred. So again, combining care with tech, providing proactive and personal care at scale is key. Now, I can give you numbers in terms of the service size. I can say that there are 1,224 residents open to Sutton alone. That's a huge number of people with the offer of proactive and preventative tech available to them. We have 506 residents in our Sutton Housing Partnership properties that will be having this tech provided to them at scale. And in the short time that we've been working with Mediquip, we've already provided over 636 preventative interventions, keeping residents safe, right-sizing and supporting them with their care. We've identified over 1,800 falls and provided a response in the community to those falls, preventing them having to go through a 999 call or an ambulance admission into hospital. We've used 760 referrals into the service, provided 760 pieces of kit to the residents to enable safe discharge from hospital, so getting people home quickly and safely. We've also supported over 450 reablement packages with tech, helping us right-size care for the residents, helping us understand their needs and getting the right support commissioned for them if they do indeed need ongoing care and support. And in many instances, they don't. Tech can be the thing that keeps them safe at home. Now, I can keep going, but I think it's pretty clear, it's obvious, the opportunity. Now, the bit that's really tricky for us all is to think about how does this all intersect, interlink with the various operational delivery models that we have in adult social care. We have care agencies, we have adult social care doing Care Act assessments. How do we bring that all together? And then we have families and loved ones supporting residents in the community as well. Now, through our partnership with Access Group, we are very much an Access local authority. We have Mosaic, we have Access Care Planner. We have all of those systems already in operation, and what we need to do now is bring Access Assure into that family and make it accessible to everybody that needs it at the right time so they can make the right decisions. So I'm going to play this video to hopefully put this into perspective for you. And by the end of this year, we are hoping to have Access Assure integrated into Mosaic. So that means we're no longer a partner sitting separate. We're very much a part of the resident journey and very much a part of the assessment, planning and intervention that residents truly need.
Care systems are often fragmented and siloed, requiring manual data entry between systems. Assistive technology is no different. We want to show you a better, more connected solution. Meet Jenny, an OT. She uses Access Mosaic daily to manage service users. Jenny conducts assessments within Mosaic for her clients. The assessment suggests which service users are eligible for support and would benefit from assistive technology. With a single click, profiles are referred seamlessly to Access Assure. From here, tech assessors can conduct strength-based assessments based on a questionnaire template co-signed by the local authority. The assessment outputs a recommendation of what technology the service user would best benefit from. The technology is installed in a service user's home, ensuring the requirements are personalised to the service user's desired outcomes. Within Mosaic, Jenny can see what service users are due their 3-month care review. Using the embedded Assure plugin, she can view key insights generated from the service user's home activity. Insights include changes in house activity, bathroom activity, start of day and overnight activity. With these insights, Jenny can make strategic decisions about the suitability and size of each individual's care package. Insights can also be shared with carers via Access Care Planning, enabling personalised and contextualised care delivery. carers can see notifications that alert them to events such as an increase in service user bathroom activity or decline in daily activity, prompting them to investigate further. With these integrations, care providers have a seamless workflow that securely connects data across disparate systems, allowing them to make proactive, person-centred decisions. Access removes barriers and brings together powerful solutions, ensuring you have the right information in the right place at the right time. Access Care. Freedom to make it personal.
Well, what does it really mean for residents? Now, you saw the video from Neris about a carer in the community trying to care for their loved ones who they didn't live close to. The data is truly making a difference. And in Sutton, we're committed to ensure that the way data is used responsibly and ethically. And you would have seen on social media the fact that we've recently published a AI data transparency document with DCIT so that other local authorities can look at that and understand how data is and should be used within the borough to keep residents safe at home. Now, if anybody has anything they would like to ask me about after this, please come and find me and I'll be happy to share with you our journey so far. Thank you.
Thank you very much. Excellent. So I'm now going to introduce Rupert Lawrence, who is the head of MediQuip Connect. Rupert is leading on the development and delivery of proactive and preventative tech services at scale at MediQuip Connect, and is supporting health and social care organisations embarking on their journey to evolve to this emerging type of service. So Rupert.
Thanks, David, and thanks to my colleagues at London Borough of Sutton and Access, who have given such a good introduction of some of the work that we've been doing in Sutton and now beyond as well. So, leading MediQuip Connect and leading on the development of proactive and preventative tech at scale is something that's really exciting for me. I've been around this space for a long time, a bit longer than the amount of times you've been here, Paul, to TSA. I think it's coming up 20 years now, but never actually seen a point where the technology and the service model around that has got so exciting and so powerful. And we're actually beginning to share data from our services to a much greater effect. But at MediQuip Connect, we've had to bring it all together, so we actually become the strategic partner for the delivery of tech, and actually have to bring that service model to life and make sure that it all works and everything knits together. As Paul mentioned, there's various different ways we think that you can do or deliver proactive and preventive tech, but having a partner that's lived that experience of service delivery, I think, is really valuable, and we've certainly done that over the last 18 months or so, particularly with Sutton. So there's some things that we've learned along the way, and we are really happy to share that with others and share our experience, some of the pitfalls, some of the kind of nuances that come along with delivering this type of service, not just at a small scale, but at a larger scale. How do you actually deliver that and make sure that it continues to be delivered? So the role of strategic partner really fully encompasses everything, and has meant that we've had to engage with a lot of people. We've had to engage and co-produce a lot of what we've delivered. We've been breaking new ground with the implementation of proactive and preventive tech packages. They look really, really different. They're much more complex. You're not just using more technology, but you're having to set up that technology in a really, really complex and clever way. We're having to make sure that those packages can really learn about that individual. The technology in there is really powerful, but there's some other things that you have to implement around certain hazards and certain changes that you need to detect. And then you need to make sure that that's happening at your contact centre level. So we've had to engage and co-produce a lot around how we actually formulate those packages of tech, getting the assessment right has been absolutely vital. And throughout that, we've had to engage with our partners in social care and at Access to make sure that we're getting all of those elements right, that it fits with the technology, but also with the people, with the professionals that are going to be involved in this whole process. Because it's really new for them as well. They're going from that reactive model to a proactive model, and we've had to bring everybody on that journey, and that's what we've really provided as that strategic partner. So one of the key ways that we've done that is through real engagement through regular innovation forums, and we've also had our retail outlet, which is just by the Civic Centre in London Borough of Sutton, just off the High Street, and we've been getting professionals involved, touching and feeling the technology, learning about how the service delivery model actually works, but crucially members of the public as well. So it's not just people accessing proactive and preventative tech via the local authority referral route, it's members of the public can come in and talk to us and find out about proactive and preventive tech. And I think that's really powerful. You know, when we're talking about how do you move from pilot to scale, it's also for members of the public as well, people who are going to pay for it out of their own money. And I think that that's been core to what we've done and how we've developed that scale. Bradley mentioned the ATRS and making sure that what we're doing and how we do it is available to the public as well is really crucial. Making sure that we can build that confidence with the people that we're looking after via the service. It's involved some serious redesign of what we've previously done at MediQuip Connect. You know, we've had a lot of people connected to our contact centre up in Rawtenstall, almost 50,000 people connected to that service, but we've had to change large elements of what we're doing within part of that service. The way that you handle multiple alerts and monitor trend changes and insights coming from the fantastic technology that we've got with Access Assure. That's completely transformed the way that we're operating as a team within that contact centre environment. So we now have a dedicated proactive and preventative tech monitoring team. They've got their own processes, they've got their own training, we've got our own approach to recruitment with that team. And shortly they're going to have their own area within our contact centre building because we're investing in our facilities and creating a whole area because we've been able to get the scale going with Sutton, and we've now got other organisations who are on that same journey to proactive and preventive tech. So we've got to expand and we've got to bring everything together. The way that our responder services work, completely different with proactive and preventative. We're not just responding to falls or no answer calls. We're responding to insights from the data. We're responding to changes. We're providing a more supportive approach to residents living out in the community. Things that wouldn't have been picked up on before, we're picking up on via the contact centre and then getting a responder out, working really closely alongside our colleagues in urgent community response services, and that partnership approach around proactive and preventive tech is really delivering outcomes, really supporting people to live healthier and more protected lives. The future, as Bradley mentioned, is really exciting. We're going to see a lot more integration with the data and the data getting into people's hands where they need it. I think the use of data within care planning and care provision is just going to get really, really exciting. And I think people just need to come and talk to us about that journey to proactive and preventative tech because organisations like Sutton have taken that leap and others are too. But it's really, really fascinating being involved and contributing to the commission that Paul's working on. Thank you.
Thank you very much. Thank you, Rupert. So now it's my great pleasure to introduce Sam Watkins, Managing Director of Data Wellbeing, and Sam will tell us about their approach, which differs a bit from that in Sutton, but is really very interesting. So, Sam. Over to you.
Thank you. Thank you, David. Okay, thank you all. Nice to see you all this afternoon. So what I want to talk to you about today is how we've developed the infrastructure that we need. So across the room, you'll see some fantastic technology companies that have got some really, really cool kit. But for that cool kit to deliver what it can deliver, you need that infrastructure in place. So our journey so far in terms of that integration, because you need the people there to deliver really, really good person-centred services. So it started back as far as 2009. So this is a long-term plan that we've had in place through a Section 33 agreement that happened with Carmarthenshire County Council and Hywel Dda Health Board. And that was about bringing budgets together specifically around older adults and how we would deliver integrated services, because our older, frail adult population don't exclusively sit in health or social care. It's always a combination of both, supported with third sector support. So for ourselves as Delta Wellbeing, we were a very, very traditional care line service, and I'm sure that will resonate with a number of you within the audience today that have got your own in-house services. And in 2015, we sat within the Chief Exec's department of a local authority, sitting alongside the contact centre where you might have your council tax queries or your bins not collected. And what the Director of Social Services saw at that point was a group of people working in a monitoring centre who actually dealt with crisis day in, day out, and they had a very, very unique skill set. So that's why they took the brave decision to move the Careline service into integrated services so we could be completely immersed in that world. But things weren't great. We were a loss-making service, non-statutory provision, but politically, obviously nobody wanted to get rid of that service because we were providing such a really, really important service. At the same time, there was quite a significant change in legislation in Wales, specifically around the Social Services and Wellbeing Act. And that placed a duty on all local authorities within Wales to focus on proactive and preventative services. So they put it into legislation for social care. And what that meant was local authorities had to have a front door for social care. Now, given the skill set that our staff had already started to develop in answering the emergency technology calls, within Carmarthenshire they chose to put that information advice and assistance service within the Careline service because they knew we were there 24/7. Social care doesn't happen 9 to 5. Those days are gone. Crisis happens at all times. And there was a huge, huge focus on upskilling our staff, our workforce, academically as well as day-to-day skills to be able to deliver that proactive and preventative approach. What we found was working within a local authority environment, our ability to keep track with technological changes was really, really challenging to deliver what we needed to do in the proactive and preventative space. So the local authority, Carmarthenshire County Council, took the really brave step of setting up a local authority trading company back in 2018. And that was very much to make sure that we could be agile and flexible and free us significantly from the bureaucracy that we did have within the local authority framework. So at that point, we definitely saw that switch from a 9 to 5 provision to that 24/7 provision for information advice and assistance for social care. And when we were set up, and still to this day, and it will continue, is having the organisation have that social care DNA run through its veins and obviously be the centre of excellence for technology-enabled care. So you may have heard this at previous conferences. We were successful in receiving a significant amount of money from Welsh Government as part of their transformation funds to set up our Connect model. And I know Carla's in the audience today. She's led on that model for us. And actually it'll be fairly similar to what you'll hear from other speakers we've already heard today. But I think for me, it's about how we put together the different component parts. So we started with a vision, we looked internationally at what that vision needed to look like, and then we built normatively. So this wasn't about a project coming to an end. Yes, we've achieved what we said we were going to achieve. No, we kept growing the project. So we started with our 24/7 monitoring centre and that front door for adult social care. Then, as part of the Connect project, we developed our community welfare response. Now, what we found within about 6 months of our community responders being set up is actually we were faced with an awful lot of domiciliary care type activities that we needed to address when we were going out. And we also saw that when we were supporting hospital discharges, again, we needed a level of additional support that our community welfare responders needed to do for the individual. So at that point, we utilised some fast tracking of regulation that the Care Inspectorate Wales had put in place, and we took our community welfare responder service to be regulated. So they are still the only responder service in the whole of Wales that's regulated by the Care Inspectorate. Now that's opened up a whole host of new opportunities for us in that social care and health space. That's allowed us to do bridging. So we have a hospital-based team, our Blue Army, that are based in Glangwili and Prince Philip hospitals. They literally walk the wards with the clinicians and look at how we can support discharge planning. In a lot of cases, they've actually replaced discharge liaison nurses. So that's allowed our health board to put the nursing profession where it needs to be and allow a different grade of staff to support with that physical planning. In some cases, we'll physically take people home with technology as they set foot outside of that hospital environment, and then we will bridge their care for up to a week so that they can settle back in their homes, and then the right assessment can be made in terms of the care that they need moving forwards. We've also done a significant piece of work with Hywel Dda around telehealth monitoring as well, again supporting people to stay at home for longer. Clearly we work with the third sector around signposting and the community pathways. And then more recently, we've started to work with adult social care on their out-of-hours social work. So the local authority used to have social workers for older adults. They're 24/7 to deal with crisis coming through, which is quite an expensive process. So we've started picking that up now, and instead of putting people into emergency placement through the night, we've been able to bridge that through our community responder service. So if we look at the outputs and outcomes that we've managed to achieve through our project, so as you'll see there, we've done this at scale. So we know what it takes to have 50 people, 250 people, 500 people, and then coming up to that 8,000 number of people coming through the system. And what you need at each different point of the scale is very, very different. We're making, on average, just shy of 140,000 proactive calls in a year. So again, that is proactive calls on scale. That's speaking to people, trying to support them in a preventative manner. Our response service, there's a missing zero at the end. There's just shy of 20,000 calls that they undertake each year, with 94% of those calls being attended to within 45 minutes. And with that, only 6% being escalated to emergency services. Now, the Falls Response Service is a really, really important service. In Wales, over the Christmas period, the Welsh Ambulance Service got into such a serious situation with their demands that we were in a no-send situation. So you can imagine as call handlers within the monitoring centres, they had nothing in certain areas they could do, and people were lying on the floor for several hours. Well, for us, our community responder service was able to really support in that time of crisis. So we've achieved a 68% reduction in escalation to those emergency services through our community responder service. The cost per hospital admission, and there is a science behind this costing, which Carla, I'm sure if anyone wants to know that science, will be able to share with you. But that cost avoidance is looking at just shy of £12,000 per hospital admission. So some of this data is really starting to stack up now, and the case for this is starting to become really compelling in terms of that proactive and preventative service. And in terms of adult social care, by being that front door for adult social care inquiries within Carmarthenshire, we're managing to turn around people at our front door 42% of the time. So that's a huge reduction in demand that would have ordinarily gone through to statutory services. So in terms of our hospital-based team, so you'll see there around 2,500 people we've managed to deal with on the wards within the hospitals, and we've supported 467 discharges over the last year. So again, freeing up those bed spaces, improving that patient flow, and on average getting people out of hospital 5 days sooner. If you calculate that up, that's over £1 million just in that one service, a service that's completely scalable across the UK. With our out-of-hours social work triage, there's 200 odd hours of social work calls we've achieved in the last year. Only 2 of those calls needed to be escalated to professional support, so a professional social worker. So those are hours that the Social Services Department were paying to have someone on call, where we've been able to support it instead. From that, 130 clients we were able to put that emergency domiciliary care type cover in literally within an hour. So the way forward for us is very much focused on the 360 view. So through all of the work that we've done in our prevention and proactive space, we've managed to build really trusted relationships with our partners. The challenge for us is that our call handlers probably access maybe a dozen different systems, because everyone trusts us to access their system but don't want to share their data with other systems, and it's been quite a territorial process, I would say. So we're trying to get the right outcomes for someone, but it's making it really difficult for us. So we heard this morning in the main plenary speech about pulling systems together, and I know in health and in social care there's an awful lot of work being done in this sphere. But actually I'm not hearing a lot of people talking about getting the contact centres, so whether that's with private providers or internally, and getting the technology integrated into that. And for us, we see that as a fundamental part of how we drive through that single vision of someone. So we're talking about integrated data from health and social care systems, which includes the technology, the wider multidisciplinary working. So this is about making sure that when someone enters a crisis, the right person is going to deliver that right care. It may not be the GP, it may not be the social worker, it could be the OT, it could be the physio, it could be someone from the third sector. Let's have a holistic view of that individual, put the individual at the centre and send the right person at the right time. When we've got that in place, we're going to be able to have data-driven insights to support that evidence decision-making. And that's about not only on that day, in that moment, but strategically how we're developing services moving forward based on real demand and real evidence that we have. With that foundation being that technology that we have in people's homes. This is completely scalable. The technology is there. We just need to adopt it. And I think for me, the clearest message I want to give everyone is it's very much a who dares wins. We're hearing from some really, really inspirational senior leaders within the sector. We heard from Sheffield last night, we've heard from Northampton today. It's the leaders that are really willing to take that leap of faith. There's enough evidence there now. I think we've collected enough. So who's going to take that bold step? Who's going to break down those silos? And are we ready to make that step? We're protecting outdated systems at the moment. Thank you.
Diolch.
Diolch.
So we've run out of time, so I was going to say four bits, but I'm just going to simply say that what we see from this is that there is a blended approach that is possible here, multiple approaches, and this very much aligns with what we heard from Minister Kinnett this morning, but also from other discussions that we've had. And it's the centrepiece of the ADAS TSA Commission that Paul is working on, where by the end of April we hope to have a blueprint which will bring together all the learnings from across the country to enable people to utilise the benefits of the experience of people who've been doing the kind of work that you've heard of in Sutton and in Carmarthenshire, from the strategic planning, the vision, through to the mechanics of how you might actually engage in a mature dialogue with providers, how there can be a really true partnership to deliver the kinds of services that you've seen today. So look out for that. End of April, we'll have some further information for you to do. So in the meantime, I'd just like to thank our presenters today, and if you could thank them in the normal way, that's very good. Thank you very much indeed for listening, and you can take your blue ears off now.